Welcome to our channel. Have you ever wondered how a simple itch could hint at something much more serious? Today, we'll uncover 5 specific areas of the body where persistent itching in elderly people could signal underlying health issues. These subtle signs might be warning us that something isn't quite right. Stay with us as we explore the potential causes and prevention tips to help your loved ones live a healthier life. Don't forget to like, subscribe, and share your thoughts in the comments. 1. Persistent itching in the armpits. Itching in the armpits may seem like a trivial issue, but for elderly individuals, it can be a sign of underlying health concerns. One common cause is diabetes. Elevated blood sugar levels can damage the nerves and impact the autonomic nervous system, leading to reduced sweat and oil production. This lack of moisture results in dry, itchy skin. Obesity, when combined with diabetes, can exacerbate the issue. Excessive sweating in the armpits creates an environment where bacteria and fungi thrive, further contributing to persistent itching. In most cases, this type of itchiness is seasonal, worsening in autumn and winter due to dry air. What sets this condition apart is the absence of visible redness or rashes, just a relentless discomfort that may spread to surrounding areas. If you or someone you care for is experiencing unexplained armpit itching, it's crucial to seek medical advice to rule out diabetes or other metabolic disorders. 2. Unexplained itching around the anus. Itching around the anus is another issue that's often dismissed, but can indicate serious underlying problems. In older adults, it may stem from rectal conditions like hemorrhoids, anal fissures, or, in severe cases, rectal or anal cancer. Approximately 75% of people with rectal conditions report some form of anal itching. It typically begins with mild discomfort that may only affect one side. But if left untreated, it can escalate. The itching can become persistent and may be worse at night, disrupting sleep and affecting daily life. Chronic anal itching that doesn't respond to creams or hygiene adjustments should not be ignored. Seeking medical evaluation can help detect and address more serious conditions before they worsen. 3. Genital itching. Genital itching, particularly in older women, can be linked to conditions such as vulvitis, vaginitis, or eczema. These issues often arise due to an imbalance in the vaginal flora, which leads to an overgrowth of harmful bacteria or fungi, causing inflammation and discomfort. Vulvitis-related itching may also present with a burning sensation, especially during urination or bowel movements. Scratching for relief can lead to skin damage and secondary infections, making the issue even harder to manage. Infections such as scabies or genital warts can also cause intense itching. Maintaining proper hygiene, wearing breathable fabrics, and seeking timely treatment can help mitigate symptoms and prevent complications. 4. Itching on the lower legs. Lower leg itching is often associated with hypothyroidism, a condition where the thyroid gland fails to produce sufficient hormones. This hormone deficiency slows the body's metabolic rate, leading to dry, scaly, and itchy skin. The skin on the lower legs has fewer oil and sweat glands, making it particularly prone to dryness. This type of itching tends to worsen during colder months and may be accompanied by tingling sensations and an overall feeling of coldness in the affected areas. Another contributing factor can be poor circulation caused by peripheral artery disease. This condition reduces blood flow, depriving the skin of nutrients and oxygen, which weakens the skin barrier and increases dryness. A combination of medical treatment, gentle skincare routines, and increased physical activity can help alleviate symptoms. 5. Unexplained full-body itching. When itching appears in multiple areas without an apparent cause, it may be linked to systemic issues like liver or kidney dysfunction. These organs play a crucial role in filtering toxins from the bloodstream. When they aren't functioning properly, toxins accumulate in the body and manifest through the skin as discoloration, roughness, and severe itching. In liver conditions, bile salts can build up in the bloodstream, leading to a deep, relentless itch that's typically worse at night. Kidney-related itching, known as uremic pruritus, often appears when kidney function declines significantly. Accompanying symptoms can include swelling in the extremities, jaundice, yellowing of the skin or eyes, and extreme fatigue. Persistent scratching can lead to secondary infections such as folliculitis or cellulitis. Early detection and medical intervention can improve quality of life and, in some cases, prevent life-threatening complications. Tips for managing and preventing dry itching. Dry skin itching is more common as we age, but simple lifestyle changes can help mitigate discomfort. A hydration. Drink plenty of water and avoid caffeine and alcohol, which can dehydrate the skin. A moisturizing. Use unscented lotions or creams with ingredients like ceramides or hyaluronic acid after bathing. A bathing habits. Limit hot showers and opt for lukewarm water to avoid stripping natural oils. A clothing. Wear soft, breathable fabrics and avoid synthetic materials that can irritate the skin. A humidifiers. Use a humidifier in your home, especially during winter, to maintain moisture levels. It's important to remember that persistent itching in older adults may be more than just an age-related nuisance. It can be a sign of deeper health concerns. By recognizing the warning signs and seeking early medical advice, you can improve outcomes and overall well-being. Understanding damp and dry itching. Dr. Emily Warren, a dermatologist from the Health and Wellness Medical Center, explains the importance of distinguishing between dry and damp itching. Dry itching is common in older adults and is characterized by dry, flaky, and rough skin. It often results from environmental factors, such as cold weather or dehydration. Damp itching, on the other hand, tends to indicate internal issues like high blood sugar, liver problems, or kidney dysfunction. Managing dry itching typically involves lifestyle adjustments, such as using moisturizing creams, staying hydrated, and avoiding prolonged hot showers. However, damp itching may require more comprehensive medical treatment to address the underlying cause. 1. Liver and kidney dysfunction-related itching. When the liver or kidneys are unable to perform their detoxification roles properly, toxins build up in the bloodstream, leading to itchy, discolored skin. For example, in liver-related issues, bile salts can accumulate in the blood and cause intense itching, especially on the palms and soles of the feet. Symptoms to look out for include a yellowing of the skin or eyes, jaundice, swelling in the legs or abdomen, chronic fatigue. Kidney-related itching, known as uremic pruritus, typically presents when kidney function has declined significantly. This type of itch is usually widespread, affecting areas like the back, arms, and legs. In addition to itching, individuals may experience swelling, muscle cramps, and changes in urination patterns. 2. Lymphoma and cancer-related itching. Cancer-related itching is often overlooked, but can be a key indicator of conditions such as lymphoma. Approximately 20% of lymphoma patients report experiencing unexplained itching as one of their initial symptoms. Unlike common skin irritations, this type of itching appears suddenly and without an obvious trigger. It persists despite treatment with lotions or antihistamines. Affects areas without visible rashes or irritation. Take the example of Mr. Robert Hill, a 62-year-old man who experienced months of severe itching on his shoulders and upper arms. After seeking medical attention, he was diagnosed with early-stage lymphoma. Thanks to early intervention, he was able to begin treatment promptly, improving his prognosis. Additional warning signs of lymphoma-related itching include swollen lymph nodes, unexpected weight loss, persistent low-grade fever, and night sweats. If you notice these symptoms, prompt medical evaluation is essential. 3. Psychogenic itching, stress-induced. Psychological factors such as stress and anxiety can also trigger or worsen itching in older adults. This condition, known as psychogenic itching, is often linked to heightened nervous system activity in response to stress. This type of itching tends to intensify at night or during periods of rest, occur alongside symptoms of anxiety or depression, have no clear dermatological cause. The cycle of itching and scratching can cause additional skin damage, leading to inflammation and infection. Addressing the underlying psychological cause is key to breaking this cycle. Relaxation techniques, cognitive behavioral therapy, and in some cases medications, can help manage psychogenic itching effectively. 4. Nerve-related itching, neuropathy. Sometimes, itching originates from nerve-related issues rather than skin problems. This type of itching is often seen in conditions like peripheral neuropathy, which is common in people with diabetes or neurological disorders. In neuropathic itching, the nerves misfire, sending false signals to the brain that are perceived as an itching sensation. Neuropathic itching typically affects specific areas, such as the arms, legs, or back, and can be accompanied by sensations of burning or tingling. Traditional treatments like antihistamines and lotions are often ineffective. Management options for neuropathic itching include medications that target nerve pain, such as gabapentin or pregabalin, a physical therapy to improve circulation and nerve health, lifestyle changes to manage the underlying condition, such as better blood sugar control for diabetic patients. 5. Age-related skin thinning and moisture loss. As we age, the skin naturally becomes thinner and loses its ability to retain moisture. This is why older adults are more prone to dry skin, particularly during winter months. The reduced function of oil and sweat glands further contributes to this issue. To maintain healthy skin, moisturize regularly. Use creams with ingredients like ceramides, glycerin, or hyaluronic acid to restore the skin barrier. Or avoid irritants. Switch to fragrance-free soaps and detergents to prevent further dryness. Stay hydrated. Drink plenty of water and maintain a balanced diet rich in vitamins A, C, and E to promote skin elasticity. Practical tips for relief. Short baths. Limit bath time to 10 minutes and use lukewarm water instead of hot. Soothing ointments. Apply a thick, unscented lotion immediately after bathing to lock in moisture. Soft fabrics. Wear cotton or other breathable materials to avoid irritation. Home humidity. Use a humidifier in your living space during the winter to prevent the air from becoming too dry. The impact of persistent itching on quality of life. Chronic itching isn't just uncomfortable, it can significantly reduce an individual's quality of life. Constant irritation can lead to sleep disturbances, anxiety, and even depression, especially when the underlying cause isn't identified and managed. Understanding when an itch is more than a surface-level problem is key to early intervention and better outcomes. 1. How lymph node swelling can signal serious conditions. Itching that coincides with swollen lymph nodes may indicate an immune system response to infections or, in some cases, more serious conditions such as lymphoma or other cancers. The lymphatic system plays a crucial role in filtering out harmful substances, but when lymph nodes become enlarged or tender alongside persistent itching, it could signal abnormal cell growth. Signs to watch for: a painless swelling in the neck, armpits, or groin, a low-grade fever and night sweats, unintended weight loss and fatigue. It's important to note that swollen lymph nodes can also occur due to infections or inflammation unrelated to cancer, so consulting a doctor for further tests is crucial for an accurate diagnosis. 2. The connection between hormonal changes and itching. As people age, hormonal imbalances can contribute to itchy skin. For instance, women going through menopause may experience a decline in estrogen levels, which affects the skin's moisture retention and elasticity, making it more prone to dryness and itching. Similarly, hypothyroidism, a condition in which the thyroid gland produces insufficient hormones, can lead to overall body dryness, flaky skin, and persistent itchiness. In contrast, hyperthyroidism, an overactive thyroid, can cause increased sweating and irritation due to overproduction of hormones. Managing hormonal-related itching involves a hormone replacement therapy, HRT, in some cases under medical guidance, a regular use of nourishing skin creams to combat dryness, or a healthy diet rich in omega-3 fatty acids to support hormonal balance. 3. Circulation issues and peripheral artery disease, PAD. Poor circulation, particularly in the lower limbs, can lead to sensations of itching, tingling, or numbness. Peripheral artery disease, PAD, restricts blood flow, depriving the skin of oxygen and nutrients, causing it to become dry, discolored, and prone to itching. Common symptoms of PAD-related skin changes include cold, pale, or bluish skin on the legs, slow healing of cuts or sores, or a feeling of heaviness or pain during physical activity, which improves with rest. Treatment often includes medication to improve blood flow, lifestyle changes to support cardiovascular health, and, in severe cases, surgical intervention. 4. Fungal infections and persistent damp itching. Damp environments on the body, such as the underarms, groin, or feet, are prone to fungal infections, especially in elderly individuals with weakened immune systems. Fungal infections like athlete's foot or candidiasis often cause itching that doesn't respond to typical moisturizers. Key signs of a fungal infection: a red, scaly, or cracked skin, discomfort that worsens with heat or sweating, An odor or fluid discharge in severe cases. Treating fungal infections typically requires antifungal creams or medications, keeping the affected area dry, and wearing breathable fabrics to reduce moisture buildup. 5. The role of inflammation in autoimmune conditions. Autoimmune diseases such as psoriasis or lupus can cause chronic itching due to inflammation. These conditions occur when the immune system mistakenly attacks healthy skin cells, leading to redness, scaling, and persistent discomfort. Psoriasis, for example, often presents as raised, red patches of skin covered in silvery scales. Lupus-related itching may appear alongside joint pain, fatigue, and photosensitivity, sensitivity to sunlight. Effective management strategies include prescription medications to control immune system activity, topical treatments with corticosteroids to reduce inflammation, lifestyle adjustments, such as wearing sun protective clothing and using gentle skincare products. 6. Preventing secondary infections due to scratching. One of the dangers of prolonged itching is the risk of breaking the skin through scratching, which can introduce bacteria and lead to secondary infections like cellulitis or folliculitis. These infections can cause redness, swelling, and even pus formation, requiring antibiotics for treatment. Preventive steps include keeping nails trimmed and clean to avoid breaking the skin during scratching, using cold compresses or oatmeal baths to soothe irritated areas, applying anti-itch creams recommended by healthcare providers, lifestyle and prevention tips for healthier skin, dietary changes, incorporate foods rich in antioxidants and vitamins, such as berries, leafy greens, and fatty fish, to support skin repair. Daily moisturizing. Use fragrance-free, hydrating creams twice a day, especially after bathing. A humidifier use. Prevent dry indoor air by using a humidifier, particularly in winter. Avoiding irritants. Choose hypoallergenic detergents and avoid products with strong fragrances. 7. The psychological impact of chronic itching. Persistent itching can have a profound psychological effect on elderly individuals. The constant discomfort often leads to poor sleep, irritability, and difficulty concentrating. In severe cases, it may even contribute to depression and anxiety, especially if the itching persists without a clear cause or effective treatment. Cognitive behavioral therapy, CBT, has shown promise in helping individuals manage the mental toll of chronic itching. Techniques such as mindfulness, relaxation exercises, and reframing negative thoughts can reduce stress-related itch responses. Combining psychological support with physical treatments can lead to a noticeable improvement in both skin health and mental well-being. 8. Seasonal itching and climate factors. Environmental conditions play a significant role in exacerbating itching. During colder months, indoor heating systems tend to dry out the air, which can dehydrate the skin and worsen itchiness. Conversely, hot and humid summers can cause excessive sweating and lead to fungal infections or heat rashes. To combat seasonal itching, use a humidifier during winter to maintain moisture levels in the air. Take cool showers in the summer and wear loose, breathable clothing. Avoid extreme temperature changes that can shock the skin. By adjusting your living environment, you can significantly reduce seasonal skin irritation. 9. Medications that may cause itching as a side effect. Certain medications prescribed to older adults for chronic conditions can cause itching as a side effect. These include diuretics, used for managing high blood pressure, that can dehydrate the skin, opioids, which are known to trigger histamine release and cause itching, or antibiotics, which may cause allergic reactions resulting in skin rashes or itching. If medication-related itching becomes problematic, consult your healthcare provider. They may recommend switching to an alternative medication or prescribing an antihistamine to help manage the symptoms. 10. The importance of early detection and regular health screenings. Unexplained itching that persists or worsens over time can be an early indicator of systemic diseases such as cancer, diabetes, or liver failure. Early detection plays a crucial role in improving treatment outcomes. Regular health screenings can help identify potential issues before they become severe. Recommended steps for proactive health monitoring. Annual blood tests to check liver, kidney, and thyroid function. Skin examinations to detect unusual moles, rashes, or signs of infection. Regular checkups with a primary care physician to discuss any persistent symptoms. By staying informed and proactive about your health, you can catch warning signs early and seek the appropriate treatment. 11. Long-term prevention strategies for healthy skin. Maintaining skin health involves more than just treating itching. When it occurs, it requires a consistent skincare routine and a healthy lifestyle. Daily skincare routine. A gentle cleansing. Use mild, fragrance-free soaps or cleansers to avoid stripping natural oils from the skin. A hydration. Apply moisturizers immediately after bathing to lock in moisture. Nutrition and hydration. Eat foods rich in omega-3 fatty acids, such as salmon and walnuts, to support skin hydration. Drink at least 6 to 8 glasses of water daily to maintain skin elasticity. Physical activity. Engage in low-impact exercises like walking or stretching to improve circulation. Avoid sitting for extended periods, as poor circulation can increase dryness and itching. Avoiding irritants. Choose hypoallergenic laundry detergents and avoid heavily perfumed skincare products. Wear soft, natural fabrics like cotton to prevent skin irritation. 12. When to consult a specialist. If at-home remedies and general medical consultations don't resolve persistent itching, it may be time to see a specialist. Dermatologists can conduct comprehensive skin assessments, while endocrinologists or oncologists can investigate deeper systemic causes. Specialized tests may include skin biopsies to rule out inflammatory skin disorders, imaging tests if internal organ issues are suspected, neurological exams if nerve-related itching is a concern. Seeking expert guidance can lead to more targeted treatment and faster relief. Persistent itching in elderly individuals should never be ignored, as it may indicate an underlying health condition. Recognizing the warning signs early and adopting preventive measures can lead to better overall health and a higher quality of life. Thank you for staying with us through this essential discussion. If you found this video informative, don't forget to like, subscribe to our channel for more health tips, and share your feedback in the comments. Your support helps us continue creating valuable content. See you in the next episode and take care.